BC health officials are apologizing now after more than 200 doses of the COVID-19 vaccine were pulled from a remote First Nations community. Michael Serapio has more on the story. Michael, our colleague Angela Starrett brought this story forward first, but it has developed. I want to give her full credit for bringing it forward. Take us through what happened here.
Absolutely, because even the details and what I'm telling you, it comes to us from Angela, Heather. But really, this apology follows what was a failed inoculation drive in a remote community of northern British Columbia. We're talking about a medical team that was sent from the Vancouver Coastal Health up to Bella Coola. Take a look at a map right now to just see where that actually is. It's about 900 kilometers north of the Lower Mainland. And the plan here was to get the Moderna vaccine to the area because, as we know, Indigenous communities have been disproportionately affected by COVID-19 and most times have poor access to health care. Now, originally, the Nuxalk Nation in Bella Coola thought the vaccines would be given to 110 members of community on reserve, starting with the elderly and immunocompromised, with another 110 doses for health workers who were off reserve, also part of that inoculation plan, working at the local hospital. But things got complicated when the doctor with the Vancouver team said the vaccines would go to every elderly and immunocompromised person who lived in the Bella Coola Valley, and that led the director of health of Nuxalk Nation to be concerned, worried that members of her community would not get vaccinated, and she, through an email, demanded that some of the supply be immediately released to the community's nursing team. Well, the doctor in charge took more than 200 doses back to Vancouver the very next day. In an email, he said the Nuxalk did not have an appropriate rollout plan, but in a recording with the medical director of Vancouver Coastal Health, he said he was upset by what he called a shocking and aggressive email that he received, all of which is very disappointing to the Nuxalk community. Take a listen to Kirsten Milton, who is the community's director of health.
I think that was really disrespectful, as well as having to call RCMP escort to leave our community. I think it was completely disrespectful, uncalled for, and didn't need to happen like that. We're extremely disappointed to see that language in the emails. He mentioned it being a gift on multiple occasions, but really using that term of a gift is what pushed us forward for not letting that go. Public health isn't a gift, so that was disappointing for us to hear him use that language.
So using the language of gift in an inoculation program, the fact that more than 200 doses was taken back to Vancouver, one cultural leader with the Nuxalk Nation believes that cultural racism, that systemic racism was at play here. And while Vancouver Coastal Health would not answer some of the more specific questions being posed by the RCBC News team in British Columbia, the BC government has apologized for what happened, Heather.
And has the First Nation accepted the apology then, Michael?
Well, we, as you saw there, spoke to the medical director, and in that very same interview, which was conducted by As It Happens on CBC Radio, she says it really is up to the High Council to decide whether or not the apology will be accepted. What we can say is that the Deputy Provincial Health Officer in British Columbia, she has now been directed to essentially formulate a culturally safe and respectful partnership with the Nuxalk First Nation going forward, Heather.
Michael, thank you.